Hello, guys. Today our topic is necrosis. Necrosis. It is defined as it is a localized area of death of tissue followed by degradation of tissue by hydrolytic enzymes liberated from the dead cells. The dead cells, the cells which got necrosed will release the enzymes from lysozymes is called hydrolytic enzymes will damage the cell, right? And the characteristic feature of the necrosis is it is elicited by inflammatory reaction. Okay, let's coming to causes. What are the causes of necrosis? It may be physical agents, microbial changes, hypoxia, chemical toxins, immunological injuries. And coming to types of necrosis, there are five types of necrosis: coagulative necrosis, liquefactory necrosis, gaseous necrosis, fat necrosis, and fibrinoid necrosis. Each type of necrosis should be discussed under two subheadings: gross changes and microscopic changes. Coming to coagulative necrosis, it is the most common type of necrosis. Mostly, it is due to cessation of blood flow, that is ischemia. If any blood vessel got obstructed, the tissues dependent on that blood vessel will get necrotized. That is the most common type of necrosis, which is coagulative necrosis, and less often from bacterial and chemical agents. That is, coagulative necrosis is most commonly occurred due to cessation of blood flow, that is ischemia, and less often from the bacterial and chemical agents. And coming to most commonly affected organs are heart, kidney, and spleen. Coming to gross and microscopic changes of the coagulative necrosis. Coming to gross changes, in early stages, it is a pale, firm, and swollen, which is called infect. It is all the characteristic features of an infected tissue, right? After a bit, it is after progression, it becomes a slight yellowish, softer, and shrunken mass, right? Coming to microscopic changes. In microscopic changes, we can appear the tombstones. Normal cells will change into tombstone-like structures. Okay, it is a characteristic feature of coagulative necrosis. Cell type can be recognized even after the necrosis because the outline remain intact in the coagulative necrosis. The plasma membrane will get ruptured. Often the cell type we can be recognized because the outline of the membrane will get intact to the necrotic cell. Okay, and the cell is swollen, have more eosinophilic cytoplasm than the normal cell. Normal cell will contain both eosinophil and hematoxylin, that is blue color, which is indicates nucleus. But here the nucleus uh, will get decreased. The amount of nuclear material will get decreased by the following process: pycnosis, karyorrhexis, and karyolysis. After all this process, the blue color tissue in the He stain will get decreased, right? The more pink material will be seen, that is eosinophilic cytoplasm. See here, more pink and less blue is seen in the necrotized area. Coming to liquefactive necrosis. In liquefactive necrosis, it is commonly occurred due to ischemic injury or microbial. There in coagulative necrosis, the most common is ischemic injury and less often by microbial injury, right? Here, both ischemic and microbial infection are common. Here, more tissue degradation by hydrolytic enzymes which cause semi-fluid like material gonna happen. The name itself indicates liquefactive necrosis, that is liquid like a semi-fluid like material. More enzyme destruction gonna happen which cause a liquid like material. Commonly involved are brain infarct and abscess cavity like lung abscess, etc. Coming to gross and microscopic changes of the liquefactive necrosis. The liquefactive necrosed area is soft, liquefied center containing necrotic debris, right? Microscopically, necrotic cell debris and macrophages filled with phagocytosed material. See here, the surrounding macrophages are well appreciated, and more pink material is seen at the center, right? Coming to caseous necrosis. Caseous necrosis. Caseous means cheese-like. Cheese-like necrosis found in the center of the tuberculous infection. Very, very, very important. You need to know this. Tuberculous infection causes caseous necrosis. The features of caseous necrosis combining both coagulative and liquefactive necrosis. The features like more or less both coagulative and liquefactive, the hybrid like material, the hybrid like necrosis it is. Coming to gross and microscopic changes of caseous necrosis. Gross changes is dry cheese like caseous necrosis is seen, no much points is here. In microscopic changes, necrotized foci is structureless and more eosinophilic. Scattered granular debris of disintegrated nuclei are seen. See here, disintegrated nuclei very less often in the necrotized area, and scattered granular debris. You can appreciate the border and which is irregular, right? Structureless. Coming to fat necrosis. Fat necrosis is a special form of necrosis where it happens in a fat rich anatomical locations of the body. Main examples are traumatic fat necrosis of fat and mesenteric fat necrosis in acute pancreatitis. Actually, acute pancreatitis is not a fat necrosis, but the fat necrosis occurred surrounding the pancreatic tissue. Surrounding the pancreatic tissue, what will be there? The abdominal fat. That visceral and abdominal fat will get necrotized by the enzymes released by the pancreas. Pancreas releases pancreatic lipases, which causes necrosis to the surrounding fat. This mesenteric fat necrosis in acute pancreatitis. Okay, coming to gross and microscopic features of fat fat necrosis. Grossly, it is yellowish white and firm deposits. Calcium soap imparts necrotized foci, and microscopically, it is cloudy appearance surrounded by inflammatory reaction. And in the sections of HE stains, we can observe amorphous granular material. See here, fat in HE stains is white in color, right? White masses of fat necrosis is seen in the tissue. Okay. Next, the last one is fibrinoid necrosis. In fibrinoid necrosis, a deposition of fibrin-like material having properties of fibrin in PTAH stain. PTAH stain is phosphotungstic acid hydrolyc something is there. That stain. In that stain, depositions properties of fibrin-like deposition we can see. The most commonly occurred place in for the fibrinoid necrosis is in autoimmune vasculitis. The necrosis, the death of the tissue happens by fibrinoid necrosis, in Arthus reaction, and most often in peptic ulcer, right? Coming to microscopy of fibrinoid necrosis, it is brightly eosinophilic, very bright. That is, it looks like almost red in color. Okay, and hyaline like deposition at the surrounding, and local hemorrhage will gonna occur due to rupture of blood vessels of that local tissue. Okay, see here, almost red color like appearance is there. That is not red color, actually it is dark pink, dark eosinophilic material. Okay, this is necrosis.